Hi everyone. This video is for those who want to learn or review how to examine pupil reactions using the APD tester. Those viewing this video could be optometrists, ophthalmologists, ophthalmic technicians, or students. I will try to make it in a way so hopefully everyone can follow along. My name is Babak Kamkar, and I'm an optometrist in private practice in Southern California. My disclosures include that I'm a consultant to Good Light and the inventor of the APD tester. A few years ago, I thought of creating a device that I could see both pupils at the same time superimposed over each other. That's because I had such a hard time examining small, dark pupils or some post-surgical or sluggish pupils. Especially after I became presbyopic, I had to tilt my head up like this to see the patient's pupils through my progressive addition lenses. If you haven't reached that age, you'll know what I mean when you get there. Afferent pupillary defects are never considered normal. There must be a reason for the presence of a positive APD finding. So how can we be sure there's no positive APD in that half a minute or less that we are given to examine the pupil right before we instill the dilating drops? As you know, once tropicamide or phenylephrine drops start their action on the iris, it's too late for any pupil testing. We have to wait a few hours until the pupil both pupils return to their natural state. So this device called APD tester magnifies both eyes, superimposes them over each other. You need to adjust your distance to the correct position relative to the patient. You would see the two eyes side by side, overlapping, or fused into one. Some clinicians may have a mild amblyopia or suppression or some other binocularity issue that could prevent them from seeing the two eyes equally well. If the amblyopia is not severe, the device still works for these examiners as well. Of course, if the examiner is blind in one eye, then they would rely on the traditional swinging flashlight test. To begin the test, the examination room should be dimmed to the level that you could still see the pupils of the patient. The distance of the device to the patient will be about 15 centimeters or 5 inches. Hold the instrument at that distance to the patient with both hands, and then get yourself closer to be able to look through the oculars, like this. Make sure you're in focus by adjusting your distance to the patient. If you see double, it's just fine. Just continue. Press the button for one of the LED lights and observe the direct response. Leave it on for about a second and then turn it off. You will see the pupil constrict, and then as you let go, the pupil returns back to its state that it was before. If you can close your own eye of that same side, then you will be seeing the other eye of the patient. And you can repeat the same test by pressing the same button for a second again. In healthy individuals, this other pupil also briskly constricts. This is called the consensual reaction. So you can repeat this test a couple of times, each time letting the pupil get back to its rest state for a second or two. Then you can shine the other pupil and look for the direct response and consensual reactions. Once you have determined that each pupil reacts normally to light, to direct light and consensual light, then you can start testing for relative afferent pupillary defect, or APD. APD testing is accomplished by sequentially alternating the light between the two eyes. Each time the light is kept on for about a second, then quickly switched to the other eye without any gap in time, like this. Using this method, you can reduce hippus and pupil release, which are part of normal reactions. If you happen to see one pupil dilate slightly after you switch the light, that would be a positive APD. It would mean that eye that dilated must have an abnormality. It's either in the optic nerve or a significant portion of the retina. It really does take 5 or 6 patients or trials to get a hang of this device. But once you do get it, it is a better way than the swinging flashlight test. In a study published in the Journal of Ophthalmology and Clinical Research, APD tester was found to be more sensitive and reliable than using a pen light with the swinging flashlight test. The APD tester can also help quantify the amount of the APD defect. The LED lights can be dimmed in steps. The levels are calibrated to the same level as standard neutral density filters. So if you detect the positive APD for the right eye, then you would start dimming the light corresponding to the patient's left eye. You would keep going until you reverse the APD. Then you go back one step at a time to find the best level where there is no APD. I will demonstrate that here. So let's say you have found an APD. Now you're going to dim one of the lights to the point that it would reverse the APD. You would do so, let's say the light that you want to dim is this one. So we're going to hold the opposite two buttons together. It flashes a couple of times. Then you press the button sequentially, and you can see the light dimming each time you do that. The level of dimming is present here. So you can see the scale, and unfortunately it's backwards because of my camera, but it says full, and then there is the level 0.6, 0.9, and 1.2, 1.5, and 1.8. These are the same levels as neutral density filters, and you can actually keep going until you find the right level. So once you have decided this is the correct level where there is no APD present at this level, then you can record it on the patient's chart. For example, in this case, it would be 0.9 log units are APD. And then you would say which eye was the defect in. So at this level, one light is dimmer than the other one. This is dimmer. And you can go back to the normal setting, the previous setting. If you hold all 4 buttons together, the lights flash, and then both of them are now full. So that's the full original state. This is much easier than using a neutral density filter in the traditional swinging flashlight test, where you would cover the eye and you could not see the pupil you're shining because the neutral density filter also blocks your own view. There are 2 other lights incorporated in the APD tester. These are controlled by the buttons in the front. So the back buttons are close to the oculars are the white lights, and the front button actually controls the other light, which happens to be a blue UV LED light. And there is both sides. They are designed for examining the cornea or conjunctiva after instilling some fluorescein dye. This is useful for when you don't have access to a slit lamp and there is some complaint of a red eye or painful red eye. And this would be, for example, in nursing homes or hospital bedside testing. And since it's a portable device, you can take it with you to these settings. Or even in the office, if there's a room that doesn't have a slit lamp, you can easily check for these things. Just put a little bit of fluorescein and you can decide, because it's magnified and the UV light, you can decide if it's a corneal foreign body, maybe a corneal ulcer, or just an aberration. One last thing that I found useful in using this device is the ability to take photos through the oculars. So I generally use my cell phone and take a quick photo from an external part of the eye, eyelids, and maybe the part of the conjunctiva or cornea. And this photo, along with the report, qualifies for the billing code 92225, or external ocular photography. So I use this device on all my patients. It makes me feel confident about my pupil testing. The website apdtester.com directs you to the two versions of this device. One version is a detector of APD, and the other has the capability to detect as well as quantify the APDs. Thank you very much for your attention.